Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you so much. Today is our weekend open clinic with Dr. Chudi, and today we're going to talk about labor, the process of labor. Can we facilitate labor? Are there certain things we can do that will augment labor, that will encourage labor naturally? Do we have proven ways? A woman that probably has gone beyond her expected date of delivery can engage in, and labor will come faster. This is very important because I'm so sure you've had so many practices. I'm so sure they've suggested a couple of things to you to do to get labor to start. So what I'm going to do this afternoon is to help you to understand if it's actually true, if it's evidence-based that you can do certain things and labor can start. So please make yourself comfortable. Remember, every Saturday about this time, we have a clinic in YouTube. Then afterwards, we also have another repeat clinic in Facebook. When you join the clinic, please announce your name, announce your location, and make it a point of duty to subscribe. Click on the subscription button, set the notifications, share the group to so many of your friends, put it in your network. Our aim of showing up every day is to educate you so you can know better. And when you know better, you can act better. If you know better and act better, then the possibility you will have a good outcome is very high. Thank you, Onyi, for coming. And everyone else out there, just make sure you introduce yourself. Make sure your questions are ready. After the presentation, I'm going to take care of your questions. So today we're talking about labor. And labor is a very important process that will eventually lead to the birth of your baby. Now, there are a couple of dates you should be conversant with in your pregnancy. The first date is your last menstrual period, your LMP. Your LMP will help us to calculate some other important dates. If we know your LMP, we can calculate your gestational age. Your gestational age is the current age of the pregnancy. It's calculated in weeks. So if we apply your last menstrual period, it will help us to date the pregnancy to tell us exactly how many weeks and approximate months your pregnancy is. Pregnancy is divided into three different pathways: first trimester, second trimester, third trimester. First trimester is the first 3 months. Second trimester is the third 3 months. Last trimester is the last 3 months. So we have the first 3 months, middle 3 months, and last 3 months. So an average pregnancy is expected to last up to 42 weeks, which approximates to about 9 months. Now, generally, women are encouraged to take their pregnancy up to 39 weeks. If your pregnancy gets to 42 weeks and you're still not able to go into labor, your provider can do a couple of things. We can augment labor, we can induce labor, we can assist delivery, or we can go for cesarean section. No baby should stay inside the womb beyond 42 weeks. Beyond 42 weeks is called post-term. 10 means your baby is good to go. The average week for term is 37 weeks. Once your pregnancy is able to get to 37 weeks, if we deliver your baby, we can assess your baby and you can go home. Babies that are born before 37 weeks are classified as preterm babies. We need to keep them back in the hospital and do a couple of things before we can send them home. Now, the question is, do we have natural things that can encourage labor independent of natural process of labor? So when I mean natural, I mean the way your body is structured to enable labor. So during labor, what happens? The cervix will begin to soften. The cervix will begin to open. The cervix will begin to give way and prepare itself so that baby will continue to descend. When baby is descending, you will be having forceful contractions, forceful, movement that will be pushing the baby down. When the baby gets to your cervix will open. It's called dilation. When your cervix dilates, your baby will gradually begin to enter the vaginal canal, and eventually your baby will be delivered. There are different phases of labor. The last stage of labor is delivering the placenta. Once placenta is delivered, you have concluded your pregnancy. This is the natural way of achieving labor and delivery. Now, it's important to understand that your expected date of delivery, it's not firm. It's a calculated medical guess of when your baby will likely be delivered. We normally use the expected date of delivery. We normally use the last menstrual period to calculate your expected date of delivery, and also use ultrasound. So some women can have their babies 2 weeks before EDD or 2 weeks after EDD. So it's important to understand this. Now, there are so many claims out there regarding things a woman can do to encourage labor. Number one is exercise. Now, it's important to understand that so long as your pregnancy is healthy, exercise is encouraged. Now, can exercise encourage or induce labor? We don't know. There are some anecdotal evidence out there. So anecdotal evidence means it's not confirmed, it's not factual, it's not supported strongly. But some school of thought believe that when a woman engages in exercise, like going for walk, like swimming, or doing anything physical that will put her heart rate on the high level, it's expected that labor will start. We cannot confirm that this is evidence-based. It might work for some people, it might not work for some other people. But generally, exercise is highly encouraged in pregnancy. So whether it works or not, so long as your pregnancy is healthy, we encourage you to go for exercise. So you can go for a long walk, you can walk the staircase, you can dance, you can swing. They are all good. When it's not directly impacting your delivery, when you exercise, it will help you to relieve stress. So when you engage in things that will increase your heart rate, that will make you to sweat, you are countering the stress. You are countering the anxiety that might be related to you delivering the baby. So it helps any which way. But there is no solid evidence to support that once you exercise about the time you're supposed to be in labor, that it will encourage labor. There is no evidence to support that. But we encourage you to go into exercise. There are so many women that did it in the past and it worked for them, but we don't have enough data to stick out our head and say, oh, exercise can start labor. We don't have such data, but we still encourage you to exercise. So long as your pregnancy is healthy, please feel free to exercise for at least 30 minutes every day. Now, the second claim is school of thought that believe that when you engage in sexual intercourse, a couple of hours before the expected labor, that labor will be induced. Now, is this confirmed? No. Theoretically, there are some reasons that might back this claim related to sex and inducing labor. Number one reason, when you engage in sexual intercourse, there is a particular hormone that is released at a higher level in the woman. That hormone is called oxytocin. When you have a lot of oxytocin in your body, oxytocin will lead to uterine contractions. But here's the deal. The level of contractions you will have when you increase the level of oxytocin is not enough to lead to labor. If that's enough, then no woman will be advised to make love during pregnancy, which is not true. We generally advise all women that are pregnant to make love, so long as your pregnancy is not complicated. Love making is very much recommended. So the first claim is the fact that when you engage in love making, you increase the level of oxytocin, which will lead to uterine contractions, which will lead to labor. But we don't have any evidence, strong evidence, to support this. Now, especially when you engage in love making and you have climax, you achieve orgasm, It's expected that when you achieve orgasm, if you pay attention to your body as a woman, you will notice that when you're at the peak of your sexual pleasure, you will notice some, forceful movement in your womb. That's contractions when you reach orgasm because of oxytocin. Now, also, there are certain hormones which we call prostaglandin contained inside semen, which can elicit some ripening in the cervix. We also believe that this might be contributing to the claim that when you engage in lovemaking, it will help labor to start. But there is no solid evidence to support this. So, what does the jury say? Engage in lovemaking freely, liberally, as you want, so long as you don't have complications. We encourage you to make love. But listen to me carefully. If you notice that your water is broken in pregnancy, lovemaking must be suspended immediately to avoid infection. Once your amniotic sac ruptures and you leak your amniotic fluid, that's an indication for no lovemaking in pregnancy. Now, the other claim is nipple stimulation. Some school of thought believe that when you stimulate the nipple in cause of lovemaking, it will also lead to increase in oxytocin, which will lead to increase in contraction in the womb. It's also not supported. There are also some claims that if you eat some type of food, some pepperish food, that it will help to elicit labor. It is also not confirmed. There is no evidence to support that. Now, this is what I will tell you before I round up. If you have reached your expected date of delivery and you're not going into labor and you don't have signs of labor, you're not spotting, you're not leaking water, you're not having any forceful contractions, ring your doctor. Two things. It's possible we didn't get your expected date of delivery correctly. There are some women that might not give us the true picture of their last menstrual period. So if we don't have your true menstrual period, we can calculate your EDD wrongly. That's number one. Yeah, there are a couple of things that can lead to delayed labor. There are a couple of things that can lead to arrested labor. Now, allow your doctor to make the assessment. Your doctor is the best person that will decide what to do. But by all standards, once your pregnancy has completed 42 weeks, we must deliver your baby. Must. No baby should be inside the womb beyond 42 weeks. Your baby is not going to do well. Once your baby is 42 weeks, your baby is fully ready, your baby is fully cooked, your baby is good to go. There is no pregnancy that will survive beyond that 42 weeks. So when they begin to tell you, oh, I had my baby after 2 years, it's completely not true. The body of a woman, the womb is structured to contain pregnancy for just within that 42 weeks. Any other additional weeks, we must deliver that baby immediately because the life of that baby is in danger. The baby can completely survive outside your body. Okay, so that's my presentation. Now I'm going to give us an opportunity to ask all our questions. So I have about 5 people in the clinic. So I encourage you to feel free, ask your questions, make sure you subscribe, make sure you set your notifications, share this channel with all your colleagues, share it in all your networks. We have so many helpful educational videos out there. And please remember to join me immediately after this clinic in Facebook. But right now, please start asking your questions. Blessing, thank you so much. You're joining from Abuja. If you are currently pregnant and you're worrying, oh, what can I do? Can I do this? Can I do that? I'm tired of carrying this pregnancy. This is your clinic. This is your opportunity. Please feel free to ask me questions in the next few minutes. Everybody is allowed to ask questions, including Onyinye and Chinyere. Feel free to ask your questions so I can give you feedbacks. Okay. Is it possible to be diagnosed of low-lying placenta at 10 weeks? That's very, very, very early. At 10 weeks, we are much more interested in confirming the pregnancy. So at 10 weeks is too early to have diagnosis of low-lying placenta. That's a wrong diagnosis right there. What we actually look out for about 10 weeks, it's presence of gestational sac and gestational pole. That's what we mainly look out for in pregnancy, in ultrasound. At this stage, it's too early to know the nature of the placentation. Way, way too early. Okay, please keep asking your questions. What exercises are unsafe during pregnancy? Any high intensity exercise, any strenuous exercise that will make you to be gasping for breath, any exercise that puts a lot of pressure on your pelvic organs, any excessive jumping up and down using heavy equipment, completely not allowed. The type of exercise we recommend in pregnancy: moderate exercise, walking, swimming, running your staircase, dancing. So moderate or mild exercise that will put you on the go. If you go to gym, don't do all those heavy lifting stuff. Don't engage in that. Don't go for any exercise that will make you feel like you're gassing out, like you're gasping for breath. Don't engage in that. That's not good for you in your pregnancy. Both first trimester, second trimester, third trimester, don't engage in high intensity exercise. It must be moderate intensity exercise. And make sure you gulp a lot of water when you are exercising, because when you don't replace the fluid you're losing during exercise, you will be dehydrated. Dehydration is an enemy of pregnancy. We don't want any woman to be dehydrated. We want you to have a lot of water in your body. Okay, when should a pregnant woman stop exercising? There is no time frame. So long as your pregnancy is uneventful. Uneventful means we don't have any worries. There is no case of leakage, pain here and there. You are anticipated. You are recommended to exercise even up to point to go into labor. The only time we tell you not to exercise is when we feel that you might have threatened miscarriage, threatened abortion. Then when that happens, we can even tell you to be on strict bed rest. But there is no time we will tell you to stop exercising. So long as your pregnancy is going okay, you can exercise for the whole duration of pregnancy. What happens to fetus during exercise? Remember, your fetus is 100% dependent on what you do. So during exercise, what happens? You will increase a lot of activity in the heart. When you increase a lot of activity in the heart, your heart will pump a lot of blood to all the tissues in the body that need blood. When you have a lot of blood in all the tissues in the body, what happens? They will receive a lot of oxygen. When they receive a lot of oxygen, what will happen? Their functions are going to be more improved. So when you're exercising, you are indirectly helping your baby to do better. So that's a good thing. Your baby will be completely fine when you exercise. Okay? How does exercise affect labor? Like I mentioned, some school of thought believe that when you engage in exercise, it will help to facilitate or encourage labor. There is no evidence to support that strongly. But what we know is the fact that during labor or during pregnancy, you have a lot of anxiety, you have a lot of stress. And when you engage in exercise, exercise will increase your production of endorphins, which are anti-stress hormone. So when you have a lot of all these endorphins, it will help to mitigate the anxiety and stress that might be related to your anticipation of going into labor. There are so many women that are afraid of labor because they've had a lot of stories that it's painful as this. So when that time of delivery comes, you have a lot of anxiety. So when you engage in exercise, exercise will help to calm you down so that you're not necessarily anxious, you're not really stressing out, and labor can take up naturally. I love all these questions. Of how long should a woman be allowed to go through labor? Now, it depends on your unique situation. You see, if this is your first pregnancy, we can allow you maximum of just 24 hours from the right start of labor. So labor goes in different phases. And for us to ascertain labor, we have to look at the cervix to know the number of cm you are dilated. So first-time pregnant women might go as far as 24 hours to deliver their baby. Once it goes beyond 24 hours, we have to reassess, we have to augment, we have to intervene and do something different. So for first-time mothers, 24 hours is the upper limit of normal. For repeat mothers have had their babies in the past, labor will be shorter. So it depends on your own unique individual situation. There are caps, but generally for all first-time mothers, we don't want you to go beyond 24 hours. Once it's gone beyond 24 hours, we have to do something. So we have stories of people that say, oh, I've been in labor for 3 days and all that. That's not good. The longer you're in labor and you're not having your baby, the more your baby is in danger. So that means you have to deliver that baby through adequate way. Okay? All right. When is the best time to start building your packed cell volume during pregnancy? Throughout pregnancy. Packed cell volume is an indicator of knowing if you have enough hemoglobin, which is the oxygen carrying capacity in your blood. When you don't have enough hemoglobin in your body, you are anemic. When you have anemia, anemia can affect pregnancy. So there is no specific time you should wait. Once you are pregnant, matter of fact, before pregnancy, we expect you to have adequate level of blood, adequate level of your hemoglobin, which will support that pregnancy, because the state of pregnancy can lead to anemia. Anemia by dilution, because pregnancy increases a lot of fluid accumulation in the body. And when you have a lot of fluid accumulation in the body, your hemoglobin tends to be low. Generally, women have lower hemoglobin compared to men because you bleed every month. And the state of pregnancy can predispose you to anemia, because there are a couple of things that can happen in the state of pregnancy that can predispose to anemia, one of which is malaria during pregnancy. So we treat you ahead on time. So there is no specific time you should start building your packed cell volume. Once you are pregnant, when you go for your ANC, we're going to check your baseline blood works. We're going to keep an eye on your hemoglobin level to make sure you're not anemic. And based on that, we can give you some tablets. We can give you some routine ANC drugs to make sure you don't have anemia. So that's a decision of the antenatal care team. Okay, I love that question. When is the best time to register for ANC? Immediately you confirm your pregnancy. Remember, urine pregnancy test is not enough. Blood test, pregnancy test is not enough. Until you've done your ultrasound, you are not clinically confirmed pregnant. So once you've gone for ultrasound and we find evidence of your pregnancy, which is presence of gestational sac and pole, then you have to register for ANC immediately. Okay, now I know there are some peculiarities in different locations, like in Nigeria. They want you to come back at a particular time, but this is the danger. There are some women that won't be doing the right things even before pregnancy. And by the time they're presenting with ANC at later date, a lot of things would have gone wrong in that baby. Do you know why? The most critical period in pregnancy is the first 3 months, the first trimester, because that's when all the important organs in the baby would have been formed, including the brain and the heart. So once you don't go for your ANC, once you don't monitor you to make sure the baby is doing fine, by the time you're coming back about the second trimester or third trimester, there are so many damages in the body of the baby that we can correct. So the earlier you register for your ANC, the better. I know some of you might want to go to, okay, babe, you're in the clinic. I know some of you might want to go to, what do you call it? The government hospital and all that, and they will tell you, oh, come back within 20 weeks. I don't subscribe to that. I'm very, very particular about pregnancy. I'm very, very particular about babies. Once you have confirmed your pregnancy, urine test, check. Urine test is quality test. Urine test is going to tell you I'm pregnant. It's not going to give you the level of the beta HCG. Blood test is more superior than urine test. When you go for your blood test, we are checking the level of beta HCG, and it's going to give us a percentage rise every 72 hours. That's very important to make sure pregnancy is going in the right direction. But ultimately, once you are done with your blood test, you must embark on ultrasound. Ultrasound is the clinical evidence that that pregnancy is actually going on well and is located inside the womb. Once you've done your ultrasound and we've confirmed that you're pregnant, that's the right time to register for ANC. Who is the best person to have in the labor room with you? Now, here's the deal. As of today, we encourage the male partners to be in the labor room. Of course, the health team, the doctor, the nurse, the midwives, the nurses that will support the doctor that will deliver, everybody should be in the labor room. But we also encourage the male partners, the father of the baby, to be there, because at that stage, what the woman actually needs is support, body, mind, spirit. So we allow the guy to go and be there. We will not necessarily allow the guy to be in the view of the delivery, especially if it's cesarean section. The guy will be on the screen behind, but he will be there to watch everything. And once the baby comes out, the first person we expect to see that baby, the person we expect to call the umbilical cord is actually the father of that baby. So the husband, the male partner, should be the best people to be in the labor room. Now, depending on your own situation, depending on your relationship, there are some people that probably might want anybody closer to them to be there. So if your male partner is not around, some people might want their mothers to be there or whoever. But the problem is, we don't want drama in the labor room. There are so many mothers and so many people that will come to the labor room and they will turn the labor room into drama. So we would rather not do that. But a well-behaved male partner, 100%, will give you room to be in the labor. That way you can appreciate things better, because there are some men that will not understand what it takes to be a mother. It takes a lot of things to be a mother. Going through labor and understanding that birth process, the pain that women go through, when you start from the beginning to see that, and because you're practically a stranger anyway. The mother already has a relationship with the baby doesn't know who you are. You know that the mother can communicate with the baby inside the belly, right? They talk, they sing, they do stuff. They know each other. So a mother and her baby, they are best friends. So but you as a stranger, you have to start early. Your baby needs to get used to your voice. You have to hold your baby. You have to call the umbilical cord. You have to start that relationship as early as possible. So yes, we encourage the males guys to be in the clinic, to be in the labor room during delivery, if it's allowed in your location. Okay, COO. I love that question from my wife. COO, you read about a lady that lost her baby after 47 weeks. Is it possible that natural labor didn't set? Of course. 47 weeks, it's about a whole lot down the road. Remember my criteria, 42 weeks. Any baby that gets to 42 weeks, it's called post-term. Your baby is fully cooked. Even babies that are born before 37 weeks can still make it. It depends on the facilities you have. Now, for a woman to get to 47 weeks, there are so many questions I want to ask. Why should a doctor allow a woman to get to 47 weeks? 47. Think about that for a moment. Remember, our cutoff point is 42. So when you were not going into labor, matter of fact, if you're pregnant in this community right now, when you get to 39 weeks, that's the time you need to put your red flag on. When you go beyond 39 weeks, labor is not coming. You get to 40, labor is not coming. You get to 42, you must report to your doctor. We must admit you. We must decide on what we need to do, especially, come on, guys, how can you come up to this point and you allow a woman to get to 37 weeks? It doesn't even make sense. Is it possible that natural labor didn't set? Of course. Probably she had contracted labor, delayed labor, or for whatever reasons. But this is the point. Expertise can come in. This is the point. A good doctor can intervene, including going for emergency CS. The problem, there are so many women and men that have done the wrong things, thinking they are doing the right things, like the insistence of delivering through the Hebrew women and all those nonsense. It doesn't make sense. The overall aim of pregnancy is to have the woman alive, have the baby alive, and both of them will be around to see each other. So it doesn't make sense. What happens to the fetus if left too long in the womb? Definitely the fetus will start retrogressing. It will start retrogressing. So the maximum week is 42 weeks. So beyond that 42 weeks, your baby is no longer going to be getting all the basic stuff that will be supporting the baby. The mother is compromised, the baby is compromised. So at that point, we begin to see a couple of complications that can be on the negative side of the baby. So that's probably what happened to this woman that went up to 47 weeks. That woman should have been sectioned. Open her or bring the baby out and everybody will go home happy. Okay? Yeah. My wife says I love catching babies. Yeah. Part of the posting you will have in medical school in your training is what we call baby catching posting. So you go to a couple of delivery clinics, maternity, and monitor and see how babies are born. Then they give you a chance to also do the delivery. So it's a beautiful thing to see babies coming to this world. My two babies, I was practically there in the theater when both of them came. So it's a thing of joy to cut those umbilical cord. That's where your relationship begins. You guys can see Zara and Dumeja. Those are my two babies. I was there when they were delivered. Okay? All right. Please, are there hospitals you can suggest or recommend in Abuja or Lagos because you are yet to start your ANC of course? I believe that's Blessing, right? Now, Blessing, guess what? Unless you're just coming to this community today, we have provisions for setting you up with caring providers all over Nigeria. So yes, we can set you up in Abuja, we can set you up in Lagos, and you can go and start your ANC. Please tell admin, I don't know if it's possible to copy the link of subscription. So Chinyere or Inye, just copy the link of our subscription, send to what's her name, Blessing, and you get your subscription and we can get you started. Okay. All right. The best prenatal is the one you will actually take. They are all good. Just stay consistently. Correct. There are so many prenatal multivitamins out there. Whichever one your body can tolerate, because some people don't like tablets, some people prefer gummies, some people prefer liquid. Whichever one, they are all good. What are you supposed to be looking out for? The contents. Make sure it has adequate quantity of folic acid, 400 to 600 microgram. There are some women that will need higher prenatal multivitamins. Your ANC doctor will give you the prescription, but the basic generic prenatal multivitamins, you don't need prescription. It's sold over the counter. Make sure it's not expired. Make sure it has adequate quantity of iron, calcium, folic acid, and a couple of other important things, and you're good to go. So yes, the best is the one good for you, but make sure you check all these criteria. Okay, guys, do we have any other question? You can see this is very, very important clinic, especially for all intending mothers, or if you're currently pregnant, please follow all the instructions I've given you this afternoon. Correct. So Nigeria, the popular one there is pregnant care. So you can go for pregnant care, and that's good. So Blessing, I'm just going to extend a hand of fellowship to you. So it looks like you're pregnant and it looks like you're not doing the right things. So if you want us to help you, hop in, make sure you get a subscription and we can take it up from there. All right, guys, do we have any other questions? Yes, COO, this particular case you just mentioned now for the 7-week, it just did something to my heart. That baby should have been here. A pregnant woman should not go up to 47 weeks. It is suicidal. At that stage, her life is actually also in danger. Yes. All right. Okay, thank you guys so much for coming. I'm going to transition to Facebook almost immediately. So I wanted to exactly, and I don't know, like in this case, if this is a real client, we can help them by reviewing, because there are certain things we don't want to happen and we can prevent them from happening. But in this situation, it's already late because the baby is already gone. Now, the best thing we can do for this mother is to encourage her, is to review her case and make sure that subsequently, when she becomes pregnant, she will make informed decision. You see, the first advocate for your baby is the mother. Even in America and other developed countries, the fact you're living in America doesn't mean you're necessarily getting the best. There are certain tough conversations you have to have with your doctor. There are certain decisions you have to query because there are negligence everywhere. There are bad doctors everywhere. So the fact you're in America or you're UK or Canada, you think is not going to be bad. It's not true. You have to empower yourself with knowledge. You have to get the facts. You have to ask the tough questions. This is what we do in our group. We empower our members. We empower our women by giving them knowledge so that when you go for your ANC, it's going to be an interactive section. It's not just going to be you sitting there and they're telling you everything and you're gulping it, so that you can know when to intervene. Okay? Correct. Having the best provider is very important. There is no way you would have been in our ANC, in SGHS, and you tell us, hey, doc, I'm 40 weeks and I'm not going to live. I'll send you to the ER. We've done it several times. Last year, our provider, Dr. Ndiche, we asked her to intervene in a lady that was admitted in one of the military hospitals in Nigeria. The lady was about dying. The baby was about dying because they were trying to do their nonsense thing. We told her to go and move that lady to a private clinic. And they sectioned the woman immediately. Emergency CS. Immediately. The lady delivered a beautiful baby girl. And she's around today to tell her story. So there is no way you will be in our group and you tell me you have gone beyond 42 weeks. I will personally call you and I will personally move you to the hospital. This is what we do. We protect babies. We save babies. So it's very sad it's happened, but we don't want it to repeat itself again. And if you're listening to me right now, if you are currently pregnant, the best decision you can make in your life, the biggest insurance you can give your baby as a pregnant woman is to get an ANC package. Because we cannot afford to hear stories that touch the heart in pregnancy. We cannot afford that. It's very difficult to become pregnant lately. So when you become pregnant, be wise. Thank you for answering my questions satisfactorily. You were bleeding seriously at 10 weeks. They rushed you to emergency. They told you have low-lying placenta. It is very difficult to stick out your neck categorically at 10 weeks based on low-lying placenta. Very, very too early. Okay? Too early. I can query that personally. Okay? Now, when you are pregnant, you need to go beyond what I'm telling you now because we have to have a relationship. I have to know you, have to know me, I have to ask you questions, I have to demand a couple of things, I have to go in deep to your own case. So just giving you feedback just peripherally and you go back and you continue doing what you're doing, I don't know how your pregnancy is going to end. So I'm just telling you categorically. Of course, I need to know the place you went. I need to know if the hospital you went is qualified. Okay? Correct. Make sure you have a doctor that listens to you. Stay informed and ask questions. That's my wife. She's a pharmacist. So she is talking from experience, her own personal experience, and her own working experience, client prescriptions. They run it. So she's talking from a place of experience. COO is also a quintessential mother. So she's also talking from experience. We're actually blessed to have all the ladies in our group as mothers. So Chinyere is a mother, Onyinye is a mother, and the longer you stay in this group, the more you acquire experience to tell others the right things to do. Okay? All right, guys. Have we been informed today? Are we all happy? So if you're happy and you know, you just give me a thumbs up, and admin wants to give me a go ahead, I will transition to our Facebook. Thank you for coming. I appreciate you guys. And that reminds me, on the 26th, we have a big event. There are so many families that want to have girls, want to have boys, want to balance their family, want to avoid sickle cell disease. It's possible to avoid sickle cell disease. It's possible to have a baby girl. It's possible to have a baby boy. But there are different ways you can do this reliably. Please go and register for the event coming up on the 26th. Gender selection and prevention of sickle cell disease in our community. We have a subject matter specialist, Professor Njako, all the way from Calabar. He's going to come to educate us on what we need to do. So if you are happy and you know it and you had fun in this clinic, give me a thumbs up before we go. And Blessing, are you promising to look after yourself and your baby? Are you going to get a package for your own good? I'm just moved by the fact you opened up. So I don't want anything happening to your baby. I don't want to see you next time. I say, Doc, I'm 2 weeks and I was going and I was coming. I don't want to hear all those stories. So better get a package. So I will keep an eye on this pregnancy, okay? All right, guys. Okay, I'll see you guys in Facebook. And great job, SGHS team. Great job, Kenneth. Great job, Chinyere. And I think I saw Dr. Ndiche somewhere. Okay, I can see Dr. Ndiche. She's just behind the scene. Great job, babe, for attending and making your contributions. And I'll see you guys in Facebook. Bye-bye for now.